The United States has formally withdrawn from the World Health Organization, ending a relationship that dates back to the founding of the United Nations global health body more than 70 years ago. For Africa, where WHO plays a key role in disease surveillance, outbreak response and health system support, the move carries real consequences. But this is part of a broader shift. Washington has also announced its withdrawal from dozens of other international organizations spanning development, climate, governance, and peace building, pointing to a wider reassessment of U.S. engagement with the multilateral system. So this week on the program, we look at what this changing global landscape means for Africa, from health security and preparedness to funding gaps and resilience. We also explore how African countries can respond in a more uncertain era. I'm Beatrice Marshall. Welcome to Talk Africa. And to help us unpack what this shift means for Africa, I'm now joined by our panel of experts. With me in studio, Dr. Victor Ngani, healthcare leader and consultant. Joining us in Abuja, Dr. Agbo Ebuta, global health expert. And from Johannesburg via Zoom, Dr. Oscar Van Heeden, geopolitical analyst. Gentlemen, a very warm welcome to you all and thank you for joining in this discussion. Dr. Van Heeden, let me start off with you. The U.S. has now formally exited the World Health Organization, and this comes alongside its withdrawal from dozens of other global institutions. From your perspective, though, what does this signal about the future direction of multilateral organizations rather than just WHO alone?
Yeah, no, I think this is consistent with what the Trump administration has been doing, as you say, over the last few months. They have withdrawn from a number of multilateral institutions. They're not interested in multilateralism. I think what is important for the viewers is to realize that when Donald Trump took over the presidency in the United States Incorporation, if we see it as a company, was in business rescue. Trump is trying to save a incorporation that is going down.
Right.
Now, one of the first things you do when you are busy with business rescue is you have to cut expenditure. You have to slash employees, which we saw that Elon Musk did in the first few months, trimming out the federal government by firing a lot of people and so on, closing a lot of things, pulling back on aid in many third world countries, developing economies. And so now it is the time of multilateral institutions, because the United States, as you know, is usually one of the big funders, whether it is in the WHO, whether it is the United Nations and many others. And I think that the CEO, Mr. Trump, has decided to withdraw from these multilateral organizations and save money, because they are not prepared to spend money on global health when their own citizens don't have access to healthcare. I think this is how we need to see what's happening here.
Dr. Ebuta, let me get your thoughts on that.
It's a very unfortunate and very disruptive policy coming from the U.S. at this point in time, where we are trying to build cohesion and build on the success on the fight against global diseases that affect countries and across borders. So it's really going to deal a heavy blow, because the withdrawal of the U.S. basically from even WHO took as much as 15 to 18% of their budgetary allocations or expenditures per year. I mean, you have mandatory contributions of up to 110 million off the table and voluntary contributions up to 600 million. That is significantly going to impact the capacity of the WHO to react to global diseases, to ensure that there's proper coordination, to ensure that there's that collectivism that builds resilience across borders. Apart from the funding that has been lost, also there's been a withdrawal of technical support in terms of human resource. The human resource from the U.S. Government plays a significant role to support the WHO. That is also going to be significantly impacted. It's going to reduce the resilience of response, the speed of response, the capacity to respond.
Right. So, Dr. Ngani, I want to build on that 18% funding that Dr. Ebuta is talking about. And if you look at Africa's perspective here, WHO's proposed program budget breakdown, Africa is allocated about 1.624 billion US dollars out of a total of about 6.8 billion US dollars. Given that Africa is one of the largest recipients of WHO supported programs, what concrete health programs in Africa are likely to be most impacted?
No, it's quite huge. I think we are looking right now at WHO, but this is a continuation of series of events actually that have been running for more than the last 1 year, where we've seen consistent funding cuts and sort of the disruption of organizations that have been quite big in healthcare in Africa. WHO has been critical in sort of coordinating the entire world to respond in a coordinated fashion to pandemics. And not just that, there are programs that are very specific to populations of the world that are vulnerable. Unfortunately, Africa is smack in this, and therefore when you see this funding gap, when you see this tech gap, then we feel that we are greatest at risk. We are going to get impacted. So,
Dr. Van Heerden, though, does the loss of a single major donor matter so much for how the organization will operate? And what precedent, though, does the U.S. withdrawal from WHO set for other countries?
It does make a huge difference because these organizations become complacent. You know, when you know that you are consistently getting money from a large funder, whether it is the United States or Japan or China for that matter, then you become complacent. You don't look around for other sources of funding. And now we find a situation that, of course, the WHO is going to be able to survive barely, but they are going to go and have to go out to some of the other members of the WHO and ask for a larger contribution. And we'll have to see who's going to step up. But it does make a big difference.
Well, Dr. Ebuta, you know, Africa is looking on, but this is not really that much of a surprise because the U.S. withdrawal had been expected since Trump's first term. How prepared is Africa, though, to cushion the impacts?
I would say to a large extent, Africa would need to step up. Preparation-wise, the deficit is significant. We have a human resource deficit that is significant. Presently, we have a gap in human resource in terms of doctors of up to 2.3 million. And at the current rate, it's hemorrhaging. We expect that that number would go up to 4 million by 2030. We also know that most of the drugs that are used locally in Africa are imported. Over 90% of medications that are used in Africa are imported. We also have it very clear on very clear terms that things like informatics, data that is important for healthcare management is very weak in Africa. Electronic medical record use is less than 15% in Africa if you compare that. So we need to quickly close up these gaps. This will require innovative interventions. This will require homegrown effort. This will require a coordination of the internal human resources in Africa. We need to audit our human resources, identify the gaps more clearly, and find alternative sources of funding. Governments must be more prudent in the utilization of funding. Funding for health has to increase.
Explore that situation for us, the gaps. Where do you still see major infrastructural gaps here in the health sector?
Well, allow me to just speak from where Dr. Van Heerden left it. He spoke about complacency. I don't see that complacency much on the part of WHO. I don't think they have much of an option because their funding has to come from governments. Governments that recognize that we have a collective responsibility to each other, that we are all human, regardless of our borders. However, Dr. Ebuta was speaking about where we need to step up as a continent, and I identify with that 100%. Because what we've done is that health is super important, and we've allowed our healthcare to be funded almost exclusively by external partners. I think collectively, if I extend it beyond WHO and look at the entire gap, funding gap in Kenya, it's almost $500 million what we get in Kenya, for example, alone. And that gap is almost a whole % of our budget. So there's need for us to prioritize healthcare and make the investments where it matters. You asked me about infrastructure that we need, and I'll speak about, maybe the pillars of healthcare. Human resource, that gap is Dr. has mentioned over 2.3 million deficit in Africa. This is something that we see in every single country. Kenya is a little bit more advanced in care, but we are still far behind. We speak about our ability to manufacture drugs, our ability to train and churn out healthcare workers, our ability to do research and fund it. We do lots of research in Africa, but it's funded by other people, and therefore they take ownership of this kind of research. There is need for us to reimagine. In fact, well, many of us look at this as a downturn. It should wake us up. It's an opportunity for us to step up, ensure that we in Africa can in fact begin to solve our own problems. The complacency has been on our side. We've been very comfortable receiving funding to sort out our issues. We need to figure it out from within our own resources. We are able to do this if we just put our minds to it.
Dr. Van Heerden, I want to explore that situation of other funders and the funding gaps here for just a minute, because in partnership with China, Africa has heavily invested in institutions like the Africa CDC. Would you say Africa is better prepared today than in the past, particularly in the areas of disease surveillance?
No, I do think that Africa is better prepared. There has been some significant strides that have been made. I mean, the intention is there to become less reliant on external aid, external funding, and so forth. But I agree with the previous speaker that too little, too late, and it's too slow. But the truth of the matter is that if there's anything positive we can take away from this, I agree with the former speaker that Trump has now put the onus on us as Africans. We need to step up. We need to begin to think creatively and innovatively to begin to look after our own health and not be so reliant on handouts, aid, and of course, from the WHO and the member states.
Right, Dr. Ebuta, Africa needs to step up. That is what we're hearing from the panel here. But let's go back to 2001, and national health budgets in Africa generally do fall short of that Abuja declaration target of 15% of national budgets for health. Health spending in Africa averages roughly 7% of national budgets and about 5.3% of GDP. How can African governments then plug this deficit in line with that Abuja declaration? What's your recommendation?
The recommendation would be creating awareness among the bodies of African leaders. African leaders must understand that the money, for every $1 spent on health, you are saving hundreds of dollars, because to a large extent you build your country resilience politically, security-wise, and in multiple dimensions. It's also very critical to understand that in addition to funding from government, there's a huge opportunity in health insurance. Health insurance penetrance in Africa is very low. You have countries in Africa with very low health insurance, to less than 20% of the population covered. The concept of health insurance allows you to collect money into a pool where you can now use to address the health conditions of your population, for those who present. And another opportunity that African leaders need to leverage on is the issue of public health interventions, preventions. You have malaria prevention programs need to be deepened. Non-communicable disease like hypertension and diabetes are increasing health burdens all over the place. So you need to be able to track patients using digital interventions, digital tools to track patients' blood pressure and sugar, and prevent major health expenditures, catastrophic health expenditures like stroke. Another issue that needs to be looked at is the issue of corruption. We know that corruption is quite endemic in some African countries. So even if you budget $100, you can expect that most of it is going to find its way to other outside what they are budgeted for. So we need to come up with systems, governance systems, tracking systems, anti-corruption measures that would ensure that money that is budgeted for health finds its way to providing solutions for health.
Dr. Ngandi, that is a very interesting point there. Allocation for health, quite a spot for African countries. Why do you think African countries allocate such low amounts to health funding? And are there, though, African countries that are worth emulating in terms of preparedness, in terms of health allocations in their budgets?
I think in terms of allocation, Rwanda has generally taken the lead. I think it surpassed 15%, and President Paul Kagame has been sort of the poster child, if you may say, in this kind of agenda. A couple of things. The challenge that we face the most is we haven't had enough visionary leaders in Africa to understand that we can build on healthcare. The second issue is we don't look at healthcare as an investment. We look at it as an expenditure, not realizing that one of the biggest drivers of poverty in Africa is poor health. So we need wise leaders, visionary leaders, and yes, we must talk about corruption. Dr. Ebuta is very kind. He says most African countries, some of us will say all African countries, we suffer from this. We need to have punitive measures because corruption in healthcare literally costs lives. And I used to advocate strongly for increasing our budgets to 15%. But I went back at some point and looked at what we were doing with the 7%, 6% you're allocating. And I must tell you it's disappointing because even that 6% could do a lot more than it's doing today. So we can allocate 15%, but if we don't plug the holes that causes these resources to leak, then we will not have the impact that we need. And therefore it comes down to leadership and governance. And this we can get right. We have brilliant people in Africa, but we must prioritize healthcare. If you stand for leadership in any African country, running for presidency or whichever other responsibility of leadership, I do pray that somehow in your heart you understand and recognize that one of your biggest responsibilities is to give your people good healthcare. It will be the biggest transformative thing we can do in our country.
Right. So, Dr. Van Heijden, I want to come back a little bit more on the issue of alternative funding and the place of multilateralism in the future now, because replacing the lost WHO funding could prove quite difficult for Africa, as we've heard. Who realistically will fill this gap?
I think it's going to be a combination of countries. You know, I think that we must move away from the mentality of one country that is going to replace the funding gap of the United States. The approach should be that a basket of countries and members needs to be approached in order to try and fill that gap that is now being left by the United States. You know, whether it is Germany, France, whether it is China, and others further afield, Japan and so forth, Canada, those are the countries that are going to have to step forward and actually spend more to try and fill the gap with the Americans, that the Americans have now left. But I also do think that, you know, sometimes we also have a situation where international organizations such as the WHO and the WTO and many others just grow exponentially because there is this funding that is seemingly unlimited. And so I do think that the WHO itself will have to also do some introspection in terms of their programs, what they are doing, their interventions and so forth, to ensure that they don't have an oversupply of human resources and an oversupply and stretched thin in terms of projects that they are doing globally.
All right, gentlemen, we'll leave it there for the moment and take a short break. When we return, we'll look beyond health and turn to what this moment means for the future of multilateralism and where exactly Africa fits as a global power dynamics continue to change. To stay with us. Welcome back to Talk Africa. Let's continue with our discussion. Still with me, Dr. Victor Ngani, Dr. Agbo Ebuta, and Dr. Oscar Van Heijden. Now let's talk multilateralism and its future. As of January 2026, Dr. Ebuta, let me start off with you here. The U.S. is implementing its America First global health strategy, signing multi-year bilateral health MOUs with at least 14 African nations. Why is the U.S. pivoting to bilateral health MOUs as it exits the WHO?
I do believe that the U.S. will feel that in negotiating directly with organizations or with countries, they can itemize their interest more clearly rather than lump it together on a multilateral framework or platform. I think it will allow US to leverage on health relationships with these countries and lift frog to other issues that may not be unlinked with some economic benefits at the end of the day. So I believe the thinking behind this is basically to be more specific in terms of outcomes that are targeted. So in 3 years' time, I am sure that there may be some renegotiation of some of those agreements, executive orders withdrawing the US from some of these agreements that they have now withdrawn from. I see the US returning back to the global stage and engaging at a multilateral level. But in the interim, I believe that the Donald Trump's position or policy direction is to deal directly with nations and try to milk that relationship in a way that favors making America great again policy.
Dr. Ngani, your perspective on this, is it about avoiding multilateral obligations?
Well, you could argue that because Donald Trump has been very clear. He wants to put America first. And in all these conversations, we've moved away from a situation where we're looking at global interests. And it's very clear, he's not hiding it, he's saying it all the time, that these kinds of conversations are putting the American interests first. For example, in the kind of agreement they've had with Kenya, Kenya being the first country which this was signed, they were very clear that two things that they're looking at. Number one is data, which will be super important. And of course, Kenyans are not happy about it 100%. And the second issue is to stop diseases coming from, this particular area into America, which is what leaders to some extent are held to by the electorates if you think about your own people. I think it's an eye-opener to us because you see, what we've done as Africa is receive and be, guided and sort of follow. We need to start leading and start thinking about ourselves. Now, the truth is that in so doing, you sort of move away from your multilateral obligations. And that's a dangerous thing. And as Dr. Buta says, I don't think that is sustainable because there's only so much you can do as a single entity. You can be the most powerful person, but again, the whole world has a lot more power and there's a lot to pick from each and every country. And so if these agreements are one-sided, then there's a chance it may not be as successful as envisioned.
Right, Dr. Van Heijden, we are also seeing, though, some new alternatives and new initiative and other platforms that are being promoted outside traditional UN structures. Are we beginning to see, as a result of the US exit from WHO and the other institutions, are we beginning to see the emergence of parallel systems operating alongside or even outside traditional multilateral institutions?
Yeah, a lot of the actions of the Trump administration has made sure that has forced the world to start looking at alternatives. It's important that we need to be clear that this Trump administration is quite consistent. What they are doing with the WHO and wanting to have these bilateral health agreements with individual countries is exactly the same thing that they are doing on the trade front. They don't want multilateral trade agreements. They don't want to have a trade agreement with the European Union or a group of African countries in AGOA and so on. They want to have it individually, and it is about them wanting to optimize their return. So I agree with the previous speaker that obviously the United States is going to want to make sure that they are the biggest beneficiary in that bilateral arrangement. It's not sustainable, I agree, but this is the model that the Trump administration has now taken on. And as for the issue around alternatives, it's not because, unlike what Donald Trump says, that BRICS is trying to de-dollarize and attack the dollar. BRICS is doing it because the United States weaponized the US dollar by wanting to impose sanctions on countries, by blackmailing them, cajoling them, and so on and so forth, using the dollar to try and suppress other countries. And when that happens, those countries naturally are going to look elsewhere to move away from the dollar, to move away from that weaponization. Similarly with trade, it is the Trump administration that has weaponized trade and have slapped countries with high tariffs, wanting to force countries into agreements and so on and so forth. And of course, what countries do naturally to respond to that is to look further afield, to diversify and the likes. It is no different within the health sector. I think that countries like BRICS, the formation, the ASEAN group, and others are going to begin to look at alternatives, and Africa needs to be at the table.
Right, so I want to get your final comments, and let me start off with you, Dr. Van Heerden. Now, looking ahead, what strategic choices should African countries prioritize to protect their interests in a changing multilateral landscape?
I think what is important with this regard is that Africa must not allow itself to be divided. We can talk of all the wonderful policies and the leadership that is required, etc., but what the collective West, former colonialists as well as imperialists, have realized with the African continent is that they can divide Africans by using money and power. And Africa needs to begin to sing off the same hymn sheet, needs to come up with common strategies, and particularly, I agree, particularly within the health sphere, but also on other cooperation issues. If we don't do this, then we are not going to advance as Africa. We are not going to be able to speak with one tongue, and we're certainly not going to be able to counter the kind of influence and pressure that the collective West is placing on Africa with regards to healthcare.
Dr. Ngani, your final thoughts.
Listening to this entire conversation, it will be the saddest thing if this phase passes and we are still looking up to outsiders to help us. For the longest time, as Africans, we have been passengers in even the multilateral world. We've not had any real power. I don't think we've had any real say. If you think about it seriously, the power has been sort of an illusion. We don't have it. Our destiny is held by others. If someone sneezes, we say we catch a cold, our healthcare sector will literally crumble if we are not careful. And so you'd asked earlier a question about what the alternatives are to this cut in funding. For WHO as an organization, yes, other countries may have to come in, but for the real programs on the ground, what's happening in Africa, it will be the saddest day if we don't step up. And we have to step up. We have enough resources. Think of it like a sleeping giant. Something has to wake us up. And if this doesn't wake us up, I don't know what will, because these conversations are not new. We have spoken for more than a decade about our intentions to have brought our targets to 15% by certain year. We've not done it. If the leaders today don't have a sense of pride to just stand up for our people, chart a new course, then you've lost an opportunity. But on the flip side, with this crisis, an opportunity exists for us to stand up, for the real leaders to stand up and get counted and say that, you know what, we are going to find solutions for Africa. It may be bitter for a short while, but if we look inwards and stop holding out our hands for arms, then there's a real possibility that going forward, because of this one event, Africa will emerge stronger. And the way we get power on the international stage, whether in multilateral settings or not, is if internally we have resilience and capacity. This is what we'd probably need to do.
All right, Dr. Ebuta, your final thoughts.
After COVID, when COVID came, a lot of us felt that Africa would have learned a lot of lessons from COVID, and post-COVID we would be building a very resilient and independent healthcare ecosystem. Now, this has failed to happen. I'm not trying to be pessimistic, but have we really learned our lesson? Are we able to learn from this situation and realize that we need to sit up? That would come with a lot of introspection. I think the African ministers, health ministers, I think it's about time they come together and increase collaborative efforts. I think just like Dr. Nyami said, our leaders must be called out in terms of trying to push them to be visionary, even if that would require some social engineering. So we must find a way to transparently report health indices so that countries that are affected with poor health indices, if necessary, must be embarrassed to take action.
Gentlemen, thank you all very much for joining in this discussion, and thank you for your insights. But that's all we have time for on this edition of Talk Africa. A big thank you to our guests, Dr. Victor Ngani, healthcare leader and consultant, Dr. Agbo Ebuta, global health expert, and Dr. Oscar Van Heiden, geopolitical analyst. Remember, you can be a part of this conversation through our social media platforms on Facebook and X, and you can watch this and other editions of Talk Africa on our YouTube playlist. Do join us again next week for more Talk Africa. For me, Beatrice Marshall, and the team here in Nairobi, until next time, it's goodbye.